Hello, and thank you for tuning in to Straight Talk for Texas Trustees. My name is Susanna Ramshot, and I oversee trustee programs and engagement for THT. This new program is a series of pre-recorded conversations between healthcare governance expert Pam Connect, President and CEO of Accord Limited, and THT's network of hospital trustees and executive leadership. As our facilitator, Pam will guide our participants through various issue areas affecting hospitals and boards across the state to share insights and lessons learned regarding effective governance and leadership. Today's conversation is titled The Board's Role in Revisiting Your Strategic Plan in Response to COVID-19. We're joined today by Ross Korkmaz, President and CEO of Palo Pinto General Hospital in Mineral Wells, Texas. Alongside Ross is Lori Boyd, Palo Pinto's board president. Welcome to you both, and thank you for joining us. Before we dive into the conversation, I wanted to share a couple of fast facts about Palo Pinto General Hospital so our listeners get to know your organization a little bit better. Palo Pinto serves a rural community in Palo Pinto County. They are a public hospital, part of a hospital district, and have a bed size of 74. They have many services offered, as you can see here, and they have a board of 7 members, 6 are elected, and they also include their chief of medical staff. You can see some of their board committees listed here as well. And this slide will be available for all of you on our website following this recording. So without further ado, I will hand it over to Pam Connect to facilitate today's conversation. So Pam, the floor is yours.
Thank you, Susanna. I'm excited about finally getting a chance to have the conversation with Ross and Lori. We did do some preparation ahead of time, so I know that this is going to be a fun discussion. So if you could go ahead and turn, Susanna, to the next slide, we'll jump right in with asking this first question. And I'm asking, what is the role of your board in strategic planning and monitoring in the normal course of affairs? In other words, pre-COVID, what would you normally be doing? And Lori, I wondered if you could go ahead and start us off with talking a little bit about what it is that your board does in this regard.
Absolutely. Thank you, Pam. So our board has taken the approach in years past, and moving forward, I see no reason that we would ever change that. We don't actually just have a strategic planning committee. Our full board participates and is engaged in all of our discussions regarding the strategic planning, along with administration. We sit down about twice a year, and we do a 4 to 6 hour strategic planning session where we lay out our goals, the things that we really want to see our hospital accomplish, maybe the needs of our community have changed. So we do this twice a year. And it's something that has really worked extremely well for us. Another thing that we do at our hospital is we continue to bring this up in the boardroom quarterly. And one of the things that reminds us to do that, because, a lot of times your board packet gets so thick that your board strategic plan and those things can fall by the wayside. We have a board calendar that we include in our pack every single month. And as board chair, one of the things that I take extremely seriously is we refer back to that calendar every single meeting and say, are we on track? Is it time to look at our strategic plan? And although our CEO and administration team is extremely good at that, it is the role of the board in strategic planning to continue that monitoring and to have a venue to do that so that it doesn't get overlooked.
Great. Does your board calendar include the other topics the board should also be considering in a given year? So one topic is strategic plan, the other might be your budget approval, the other kinds of things that you need to approve. Is that what you mean when you say board calendar? Or is it specific to the strategic planning piece?
It is a very specific calendar that's outlined monthly. So maybe in September, you might see our calendar say approved budget and approved tax rate. In November, you might see it say offer new contract to existing, to CEO or CEO review.
Great.
And quarterly, you will see it say review and have strategic planning updates. So we will set aside about 30 minutes during our board meeting for administration and us to review where we are in our strategic plan.
Great, thanks for clarifying. I think that's a best practice to have that kind of calendar that really keeps the board on track and sets the expectation that board and management team are going to be talking about these things during these particular times of the year. That's great. Ross, can you tell us a little bit more about the content of the strategic plan?
Yeah, certainly. So, like Lori said, we meet a few times a year. It's included in the packet monthly. We review it very specifically quarterly. And then at every board meeting, I also give a CEO report that often includes a lot of information that relates back to our strategic plan, the things that I've done or we've done as an admin team in the last month. And so that's some of the things that we do as the admin team to help keep the board involved in that, because they're a key component of this. And so the strategic planning process starts months in advance with simple conversations, with retreats, and then we put together a strategic plan, and I think ours is 45 to 50 pages long and has very detailed information from very broad goals and objectives to very specific information.
Speaking of which, Susanna just turned to one of the slides that you had provided for us. Why don't you describe to our audience what this particular slide is about?
Yeah, so this slide was one of the first slides in in our strategic plan. And what this was exactly what it says, our objectives, goals, and then we put the word dreams in there, because I think as a CEO and a board, you've got to be a dreamer sometimes, and you've got to look not just this year, but 3 years, 5 years, where do we want to be? And so this was just a very broad, sweeping list of things that we wanted to start working towards. And then we got more specific later on in the strategic plan. And that second bullet point there, recruit primary physicians, specialists, mid-level providers. That's one that you'll see in a later slide, has very specific goals and objectives around it.
Mm-hmm. So this is your longer term vision or strategic direction, what you and the board have agreed together you're working towards.
Yes, and I talked about bullet point number 2, but I can't miss bullet point number 1, focus on continuous quality improvement. That is something that we've said, and everybody who's listening to this call knows that's not 1 year and you're done. We don't put a stamp on and say, well, we've improved quality, we're done. That's going to be something that's always on there, and that's always going to be a focus at this hospital, as well as I'm sure it's at every hospital. So we have to dig deeper into, that's a pretty broad sweeping, statement, Ross. How do you then implement that? How do you operationalize that? How do you measure it? How do you track it? And those are the things that we report up through our board quality committee.
Great. Before we move to that next level of detail, I just wanted to check in and see if Lori wanted to make any other comments around the process by which you create this long-term vision for the hospital. Any additional thoughts?
Yes, one of the things, especially when we go back to the question that you asked initially, what is the board's role in this? So when we look at this slide, obviously this is what has come out of our 4 to 6 hour plan, and it's a planning date. And there's a lot here, but the role of the board, and I think Ross would agree with me on this, is for each one of these bullet points that's on here, someone on the board must be asking the question, what can the board do? What do you need from the board to accomplish? Number 1. What is the board's responsibility? Our responsibility is to make sure that our team has everything that they need. So we have to remember to ask the question, what can the board provide? What more do you need from the board to accomplish these objectives, goals, and dreams? And I think that is something we should all be moving towards as a whole.
Mm-hmm. Great. Well, let's then dive into bullet number 2. Ross, you were starting to say that you have some more detailed information on that. Could you explain what this next slide is?
Sure. So what we develop is so as I talked about, we have some kind of broad goals, but then we break it down into very specific service lines, surgery, outpatient growth, primary care growth, a number of others. But you can see here is our primary care growth. And what this is we took the strategic plan and then we took those specific action items and put it into a tracker. It's very simple. We put it into Excel. It's something that we keep track of here in administration. We know who's working on what, and then we're able to report back to our board on some of the things that we've done. So you can see, number one, recruit primary care providers to support our community. We recruited a family medicine physician, and we're starting a pediatrician. So that one was completed. And so, but we've also had things, and I know we'll talk about this a little bit, we've also had some things on here that we had to step away from, things that we had to discuss with the board about whether or not we can move forward with those in the given climate that we're in. And so we've pushed some of these faster, like number 5, telemedicine. You know, that's something that has been a big focus. We pushed harder on that, and then we had to readjust number 6. We started using our Bridge to Health, which is a rural healthcare bus, to help do drive-through COVID testing that we set up here at the hospital. So we had to reallocate resources and restructure some of the organization to support the current climate that we're all facing.
Well, let's go right to that topic. Suzanne, if
Absolutely.
you could flip to the next slide. We have a very specific question that says, which strategic initiatives did you accelerate or put on hold due to COVID-19? You've already started talking about that, Ross, so why don't you keep going? Tell us a little bit more about that.
Absolutely. Sorry, I get excited about that. So,
okay.
So, you know, telehealth is, you know, it was on the list. We're going to work on telehealth this year. We're going to really focus on that. Well, it became real apparent to us very quickly that we needed to move a whole lot faster on telehealth initiatives. And so 3 main initiatives that we've done this year is started offering telehealth out of our clinic. That was a main thing, out of our community care clinic, so that we could continue to take care of patients when they couldn't come to see us. We have also implemented a partnership with Access Physicians in our ICU to provide 24/7 telepulmonology and intensivist coverage in our ICU, as well as in September, we will be rolling out a school telehealth initiative. So all 11 schools in our county will be getting telemedicine carts, and they will have direct access to either a physician or a advanced practice nurse practitioner in either our urgent care or community care clinic, so that we can provide care to all of the students in our community. And we recognize, I learned a lot as we've been trying to roll out this project, of the kids in our community that don't have insurance. We have children in our community that are homeless, and we need to be a leader, and very excited about some of those initiatives surrounding telehealth. Another major initiative for us this year is we have a very busy emergency department, and we've also been growing interventional radiology. And so we needed to install a new CT machine in our emergency department. And we've gotten some plans together of where we were going to install this CT machine. Well, it turns out where we were going to install that CT machine is exactly where we have our ED COVID unit, which is a unit that we had to design and build in a short amount of time to provide a negative pressure area and a safe place for patients that are, you know, either presumed to have COVID or are COVID positive to come in, receive care. And so it's a good thing that we didn't actually install that CT, because that's exactly where that new COVID unit is. So we're having to literally go back to the drawing board of how are we going to do this forward. And the board has been supportive of that. When we go to the board and say, I know we said we were going to do this, I know you approved this, I know we were about to knock some walls down and put a CT, but instead I've put up, you know, a negative pressure area to take care of COVID units or COVID patients. And so it's you know, it's been a time we've been able to work well together between administration and the board to take care of patients, because that's the ultimate mission. We've got to take care of our patients. We've got to take care of our staff.
Sure. Laura, you want to comment on what it felt like to be on the board when your CEO was coming in saying, well, due to COVID, we got to change some of our strategic plan?
It felt very fast. And I think that we agreed from the very beginning that COVID was changing so quickly that the board was going to have to make a commitment to administration and specifically to Ross, that we would act quickly and that we would you know, take his information to be as transparent as it could be on that day, knowing that it might be different tomorrow. And so we knew we had to be there and act quickly and be supportive, and it paid off for us. And we're still moving forward with that, and things still change daily, but it really is a nice time to build relationship with your board, your administrative team, your CEO. It's the perfect time to practice those things.
We'll come back to that in a minute, because I want to make sure that we hear about any other strategic initiatives that you felt you had to perhaps put on hold. So you had talked about accelerating telehealth beyond what you originally had planned to do, and this change in how you're going to use the space. Was there anything you just said, you know what, we have to hold on this initiative?
There were some other initiatives. I'll use wound care as an example. We were going to evaluate wound care and really dig deep into seeing if that was a service line that we wanted to and needed to offer at our hospital. And we needed to put that on hold. We needed to refocus our efforts. We had some smaller ones, things like really looking at maybe we needed to start into workers' comp and occupational medicine. Looking at some other smaller services, I'd say Medicare annual wellness visits. That's something that we can really push, and it's a way that hospitals can drive a lot of business through the doors. But just had to step back from some of those smaller strategic items that, while we do know we need to continue and we need to do them in the future, but there's a limit to what we can do. And when we have a limited amount of time in the day, we have to focus on what's most important. And that's something I want to make sure I say this, is that our board and Lori said to me at the very beginning of this, take care of the patients and take care of our staff. Go do what you got to do to take care of them. We'll figure out the rest. And so we still have moved forward with, physician recruitment. We had a number of physicians coming on this year. We couldn't stop that. We're not going to turn down physicians that are already committed here. And so we continued with some of those. I'm trying to think if there was another thing we're doing this year that I think was kind of a stretch for me a little bit, was a community health needs assessment. And I had thought about it and finally reached out to Lori and was like, Lori, I'm thinking about doing this. What do you think? And she said, absolutely. And the more I thought about it, it really isn't. It's a unique time to do a community health needs assessment, to really get out there and ask folks what we need to be doing in this time, and not just as the hospital, but as we take care of everybody in our county and some surrounding areas. What do we need to do to improve the healthcare of our community?
Lori, why don't you go ahead and talk a little bit more about that, since the community health needs assessment is one of the things that every hospital board must do, according to the law. You want to say a little bit more about why you thought that this should be done at this period in time?
Well, I don't think things are going to change anytime soon. We are only going to be faced with bigger complications from COVID-19. And so we're going to have different needs from different areas in our community. And anytime you do a community needs assessment, I think you find out something new about the population that you serve. And so with that being said, there are so many things that I think that we can learn from a community needs assessment as we move forward into our strategic plan. Maybe we have people who can't get to the facilities. Maybe we need to change our access points. Maybe transportation is a problem. Just different things. I think that we are going to learn a lot of things this year due to COVID-19, things that have changed. Parents maybe that are at home or have children that are at home. Access points to the hospital have been something that we've really focused on. So I think as we do this assessment, we'll learn also what kind of, maybe we think we need a certain specialist, and maybe now we know that parents in the community think we need a different one. So we have a lot to learn from this assessment. And I think part of it is the nurse in me is extremely interested to know what other people think we need. And our community is very vocal and supportive of our hospital. I think that's something through this that the board has really been extremely pleased with Ross and his team, is they've kept the community extremely engaged. So now more than ever, I think sometimes you send out a needs assessment and you get nothing back or very little data. But while we have the community engaged, I think we can get our best information.
Mm-hmm.
So, very
Yeah,
exciting.
it's very interesting as I think about the role that a community health needs assessment can play in the middle of a pandemic. Is most hospitals and health systems and other organizations are finding out that the pandemic has shown some weaknesses, perhaps some areas where our healthcare system, broadly speaking, is not really taking care of everybody. And the community health needs assessment process, which usually engages lots of different community members from lots of different places, can be a wonderful way to figure out where were those gaps? What is it that we didn't even know we didn't know? And so kudos to you for moving ahead with it and thinking of it as a learning opportunity. Well, let's go ahead and move to our third question. If you could change the slide, Susanna, for us. Laura, you started talking about this, and Ross has too, but I think it would be useful for our listeners to hear, how has your board fostered trust and communication between the board and management, and then among the board itself? Lori, could you go ahead and start us out on that?
Well, I think that this is a huge question, and I think that it has to be intentional. I don't think you should just wake up and say, we have so much trust. I think that you have to intentionally seek out this as an opportunity to grow your board, grow your relationships. One of the things that we really talked about from the beginning was, can you over communicate? Probably not, but should you communicate every single thing? Administration is incredibly busy, and so we have felt like it was very important to give Ross and his team the time to do their job. So we sat down and said, we're going to talk every week. Ross and I will talk. We'll meet before our business executive meeting, and we'll kind of talk about things that are going on. But for the most part, one way that we fostered trust is we've just said, if you have a question, email me, but let administration do their job. Give them the time and the trust to do, because transparency is important to us, but also it's not the time to inundate your administrative team with extra chores or tasks.
Right, during a pandemic in particular is a really...
Absolutely, and I think that's been important to us as a board, is to show the administrative team and Ross especially, we trust you. We said one thing in the beginning, and Ross spoke to it earlier. Your job is to take care of our community. Please do your best. Take care of our faculty, or our employees, and the people that we love. And they've done that. We've given them the room to do that, with the expectation that they've come back to us with what they need and what is happening. And it's really been intentional. It hasn't just happened. So it's a great opportunity. It's a great time to do these things.
Well, Ross, why don't you speak from management's perspective about how you think the board and your team have fostered trust and communication?
Yeah, absolutely. I'll echo what Lori said. We speak all the time. I can call her whenever and bounce ideas off of her and just get some ideas. Same with other board members. So we've communicated out to board members, sending out, email updates of how the hospital's doing, how, what are some of the things we're doing, how much PPE we have in stock, what are some of the things that we need to do, and they've been supportive of everything that we need to do. We've also, as far as, continuing to foster that communication, not just with the board, but with staff, started an employee-only Facebook page. We do updates on that as well for our employees, as well as updates to the community, because I think, that trust between the board and administration is imperative, but the community's got to trust that the people leading this organization are doing the right things right. So we've done a number of things that I will be the first to admit, I do not have a Facebook page. I do not engage much in social media. Just avoid it. But I have an excellent marketing director that pulls me into that. And we've partnered with community groups, and we've done doc talks, we've done Facebook Live events, and we've done a number of different things and got everybody from our lab director to medical director of hospitalist services to the ED director to speak directly to the community. And I think that builds trust with our board, because our board members are on there seeing our director talking about what we're doing at the hospital, how we're keeping them safe. We've posted YouTube videos. We've tried to engage the community that Lori was talking about earlier, that community engagement with the community health needs assessment. And so this has been a time for us to build the trust between not just internally, but externally as well.
Mm-hmm. Which is, of course, one of the key roles of a board, is to make sure that the board and the management team understand the needs of the community, and that you're communicating back and forth in two-way communication around, oh, these are the needs. Well, here's some things we're doing to try to help you with those needs. We're listening, to anything else that you need us to be paying attention to. So I think that's key. Well, clearly, your board and your management team have created a foundation of trust and communication. It sounds like that's one of the major examples of why you've been so successful. I just wanted to circle back around and see if either you had any other comments regarding the bigger question of what should the role of the board be in revisiting a strategic plan due to COVID-19? Anything else that you would provide as guidance to your peers, whether they're CEOs and or board members, regarding the importance of revisiting your strategy at this point in time? And Ross?
Yeah, Pam, I'd like to say a little bit on that. I think, our board's done this, but stepping back and looking again at how, we were going to be measured this year, all the things we said we were going to at the beginning of our fiscal year versus what we've done now. And the board, all boards out there, understanding that hospital leaders have had to change. We've had to pivot. We've had to step back from things that we said we were going to do to go do things that we needed to do. And so I think it's important for the board at this time to maybe, recognize what's been done. And our board has done an excellent job with that. But I know I'm speaking to my peers and colleagues out there that recognizing what else had to be done this year, that other things may have fallen off the plate. And that doesn't necessarily mean that they may have done a poor job by any stretch of the imagination, that hospital administrators were doing what they had to do to take care of patients. And that this has been, I've used this before, this has been all consuming. I mean, there's been weeks and months that have flown by that I feel like all I focused on was one area. And so I think the board revisiting that and understanding that hospital administrators had to pivot in these circumstances is imperative, and to recognize that.
Sure. So that obviously relates not just to revisiting the strategic plan and all those goals you set regarding the strategic plan, but it also actually impacts the performance management system. In other words, the CEO's evaluation and the other senior team evaluations.
Yes.
Right?
Yeah, absolutely. And actually, our CEO board evaluation compensation committee met with me a couple months ago and looked at, what we were going to accomplish this year. We were going to, the things that we were going to do, and we were going to increase admissions and we were going to have I think our goal, 10% increase in surgeries this year. Yeah, that's not going to happen. But they were complimentary of what we have done to take care of our patients and our staff. And they recognize that those goals, maybe they're great goals for next year or the following year. And that we, again, had to change direction and focus our efforts elsewhere. And there's just some things that were beyond our control. When hospitals are shutting down non-emergent procedures for a month and a half, that's hard to come back from. So our board has been excellent at that. And I would encourage other boards to reevaluate their evaluation system of the administrative team.
Mm-hmm. Yeah. Lori, would you agree with the way Ross described that sort of change in plan regarding even the CEO evaluation, not just the strategic plan?
I'm 100% on board with everything Ross just said. It's really true. No one could have predicted this. Through this whole process, we may not have accomplished everything that we wanted to accomplish this year, but we accomplished a lot more than we had on that list. They identified gaps that we didn't know we even had, and were able to fix them. So there were a lot of things identified, and that will continue, I'm certain. Things that they had to fix, things that they had to rework. And administration, I think, one thing I would say is our team has worked with no time off. Absolutely no time off. And that's something that is invaluable, because they're doing it because they love their community. They love what they do. They want to get it right. And as a board member, I would encourage other board members to recognize the fact that these are things that are out of their control, but the education that our administration has given the community has also affected the board members. We are also the community. We are also taxpayers. So I cannot thank them enough. And reevaluating the entire system means changing how you're going to evaluate your team this year. So I agree with you, Ross.
Right. So it sounds like you have the culture in place that is healthy and allows these conversations to happen, that you have lots of processes in place that make sure that you're revisiting decisions that you've made, and that the board itself understands its role and is willing and able to let management do its work as it needs to, but then as necessary comes back and monitors the work that the two of you, by that I mean the board and the senior team, have decided on. So I think each of those sound like they are important components to the success of your organization in the past and moving forward. So any closing comments? Ross, let me check in with you.
No, thank you for the opportunity to be here, Pam and Susanna. We really appreciate this opportunity. And I looked at some of the other colleagues of mine that were going to be speaking in this Straight Talk series. And one of them is a former CEO of mine and a mentor of mine. And it's a proud moment to be included with him. And so thank you for this opportunity. Really, I have a big smile on my face because it really means a lot to me.
That's great. Lori, any closing comments from you?
Well, I would just like to say that when you are genuine, it just goes a long ways. And so that was, this has been a very genuine, I think, conversation that we've had today regarding the changes that we've gone through. And I hope that it does help some of our peers. That's the whole idea behind this. And we just appreciate getting to share our story. I laugh a little bit because it seems like it's been so, cut and dry, but it has been, difficult, but at times so fascinating. And I'm looking forward to the next 6 months to a year working with our team and growing together and taking care of our community. So I appreciate you guys having us today.
Well, thank you. Susanna, you want to go ahead and take it from here?
Sure thing. Thank you all. What a wonderful and especially heartwarming conversation. Really just thank you, Ross and Lori, for sharing so candidly your experiences and advice around strategic planning in pandemic times and not. I think you really drove home how strategic planning actually translates into caring for your community and stakeholders, and that's just really special stuff. So thank you, really, thank you. As a reminder to all of our listeners, continuing education credit is available for you for tuning in. So please visit tht.org/Straight Talk to download your continuing education form. Some additional information and resources from this conversation will be available on our website as well. And episodes of Straight Talk for Texas Trustees will be dropping on our website monthly. So please keep an eye out for the next conversation. Thank you all again for participating today, and please stay healthy and safe there. Thank you.
Thank you.